Guys, Dr. Torado here, your West New York chiropractor, and today we're actually talking about low back pain and specifically herniated discs. Can they actually be healed on their own without any type of surgery? Well, it turns out that herniated discs more than likely lead to surgical intervention, right? But there are some patients that show that have herniated discs that have actually been successfully been able to kind of ride it out, and they found that after 6 to 12 months after they have ridden out the pain, that the pain has actually gone away, and they've gone for MRIs, and the MRIs have shown that these herniated discs are actually mysteriously gone. The theory is that there's some interplay between some of the molecules inside the discs and how they heal. And a lot of researchers over at the Vanderbilt University Hospital have actually investigated this, and they're showing that some of these herniated discs are actually healing themselves, contrary to popular belief. About 60% of the people in this country suffer with herniated discs at some point in time during their lifetime. And so there's upwards of over about 300,000 surgeries that occur during the year that actually are specifically for herniated disc treatment. Now, Dr. Dan Spiegler from Vanderbilt University states that about 50% of these people that have herniated discs actually improve within 6 weeks. And the actual herniated discs may resorb back into the disc over time. But what really troubles Dr. Spengler and a lot of other researchers is that why doesn't this occur with every single person that has a herniated disc? So they did some research and they looked at the molecules that are inside the disc here, right? This would be a herniated disc pinching on a nerve causing sciatica. And they found that inside these discs, there are these molecules called MMPs, right? And these MMPs act like little Pac-Man guys, pack, right? And these Pac-Man guys literally chew right through all these other proteins inside here that have been damaged, right inside there. And when it chews through a lot of those material inside there that's been damaged, it actually causes the disc inside there to kind of resorb, to kind of get sucked back in to the disc and heal the herniated discs. Also, it shows that when this herniated disc actually does herniate, a lot of bleeding occurs inside there, and a lot of white blood cells go into that area. And when white blood cells go inside here, there are these other type of super Pac-Man that come in. They're called macrophages, and this is what's part of our immune system, and it floods this whole area with these Pac-Man, and it actually helps clean up the entire area and heals the whole thing. So what's really, really surprising about this is this interplay between these MMPs and these other macrophages that actually develop inside there. They're just really starting to do, this is really the pinnacle of the research that's going on right now. They're studying this more and more because they want to find how they can duplicate this process and heal a lot of these other people that have these herniated discs without having to go for these crazy surgeries. So what's the take-home message here? It's very, very simple, people. The message is that if you do have a herniated disc, right, and there is some pain inside there, right, if you don't have any type of neurological loss, meaning if there's no weakness inside your legs, if there's no, if your reflexes are good, there really at this point is absolutely no rush to go out and go get surgery, to go and cut yourself, right? There's no rush, right? Doctors of chiropractic offer natural pain relief. And I treat tons of people that have herniated discs, and we've treated them successfully without having to go under the knife. Obviously, it's a process, and it takes some time, and it doesn't happen in one visit like that, but I have treated people successfully with bad herniated discs that were recommended to go for surgery. We've treated them with natural chiropractic and the techniques we use inside this office, and they've been able to manage their pain successfully and heal their herniated discs. So that's it for today. I'm Dr. Jason Torado. Thanks for listening to me. I'll talk to you soon.